Now I'm still in Zimbabwe, and now that I have 2 extra days, I'm taking the time to reflect on my trip and particularly how the COVID-19 pandemic um, is being handled, um, not from a health perspective, but I'm more interested in how it's being handled in commerce and industry. And as a Malcolm Baldrige examiner, I usually look at um, the needs of process improvement and performance excellence management. And there is quite a need um, for commerce and industry to really have people examining how safety and health measures are being implemented in commerce and industry. And I've had a number of conversations with different people, uh, pastors, with store managers, and and I'll tell you maybe three anecdotal stories where I am looking and noticing that we do really need to think seriously about how we are implementing safety measures because change is hard and cultural change in behavior is really what I'm beginning to think from my observation is creating a lot of cross infections because yes, people, and I'll start with the wearing of masks, which is something that I've brought up before. People are wearing masks, but you see their nose is open, or they've got a mask around their ears, but it's under their chin, and they are not consistently covering their chin all the way to the top of their nose with a mask. And they're going around like that forever. So I had a conversation with my cousin who's a pastor, and I was saying to her, I'd seen a video of where she was preaching, and I was saying to her, why is it that I see some of your congregants without mask and some of them not wearing masks properly? And she says, believe it or not, we are always telling them to keep your mask on. And a lot of them say, well, I have to pull it down, leave my nose out, or pull it under my chin sometimes while they are not socially distanced in the pews in the church because I can't breathe behind a mask. And I say to her, do you realize that those very people who can't breathe behind a mask are the people who actually need to be wearing a mask properly all the time because they have compromised lung function. My pulmonologist um, told me an exercise that I do every day. Says breathe in for 10 seconds, then hold your breath for 10 seconds, and then breathe out for 10 seconds. That's how you exercise your lungs to see the function. And if you can't do it and hold your breath for 10 seconds, then your lung function is compromised. Then the other thing that I found out, so that's the issue with the use of masks. Then there's the issue of social distancing. I've had to tell people several times that please, uh, you're in my personal space, you need to step back. And really, I think it's an unconscious behavior manifestation where people don't realize they're so close to you. And now, with the requirements of social distancing, it's kind of very difficult. But this is another thing that has been happening. So that was the first thing about the churches and people in the pews sitting next to each other singing inappropriately wearing masks. The second one was I had an encounter. I like to wear gloves when I go out because I've been noticing that retail stores are cutting corners with their implementation of PPE. And as a businesswoman, I know it's expensive. I've had to invest in PPE for my businesses as well. We have a hospitality business. But another thing that I noticed is I went to an OK, it's called OK Mat here in Harare. It's like the equivalent of well, Walmart or Costco in the US. And I went there and I saw people, the cat collector collecting cats in the parking lots, putting them by the door, and then when you walk in, people spray your hands, and then three people, three guards at the door, and they told me, take off your gloves. And I'm like, I'm not taking off my gloves. Well, then you have to talk to the manager. I said, okay, fine. So I went about my business, got my cart around, got the things I wanted. And then when I had finished my purchase, I went and I said, I want to talk to the guy, to the manager about this idea of me not wearing my gloves because I don't understand. It's an extra precaution that I have to wear my latex gloves. So the manager came and he said, well, we are not allowed to wear gloves. I said, why not? Because people were bringing their own gloves and some of them are pre used and they're touching our products. I said, but I'm also noticing that you are not sanitizing your cuts. Oh, but we are sanitizing our cuts. I said, no, you are not, because several people have come in and we have to get the cuts outside. The cuts that are sanitized should be inside the store. And so he was like, well, you know what? Gloves are not allowed. Now, the funny part about Zimbabweans is they will be polite, but they're very passive aggressive about their response to you when you're making objections. And I said, no, you're not sanitizing. and and sure enough, a woman came in, took a cut, they sprayed her hands, and she walked in. I said, I've been observing while I'm in your store, people are wearing masks, they're rubbing their nose, they're wiping sweat because it was very hot that day, and they're putting their hands back on the cut where you sanitize their hands. You put a little bit of sanitizer in their hands when they were walking in, but they're touching themselves, touching everything. And as someone who's very conscious of pre-existing conditions, I want to be safe, and I have to take the extra steps that you're not taking. So either you provide me with your own gloves that you know are in good condition, they're brand new, or I bring my own. Oh, no, 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 no. We don't want people using their own gloves to touch our products. I said, well, here are my gloves, and I was wearing, cream latex gloves, and sure enough, they were all dirty, and when I lifted my hands to show him how dirty my gloves are, he was like, his compromise was like, when you, okay, next time you come, um I'll give you a shopper who will handle the cart for you and can pick the products from the shelf for you until you check out and take out the um, the products to your car. And I kind of laughed and I was like, okay, so we'll do that. So he's been doing that ever since. Every time I go to that store, and guess what? It's creating employment. Now that's the upside of the pandemic, that it has created a lot of uh, little jobs. But I missed my flight yesterday, and it was because of those little jobs that have been created that require monitoring of performance of the workers that have been assigned to help. So, what happened was I got to the airport on time. Now, I also have to admit, I also was observing after whatever happened. I was observing my behavior, and instead of the usual 1.5 hours I give myself to get to the airport, to be at the airport, check in 30 minutes, and be waiting in the lobby when all is done, I should have given myself at least 3 hours. But anyway, got to the airport at 11:30, and there was a big line outside. I go ask the lady in the front who was letting one person go in one at a time with their luggage. Says no. I said this is for all airlines because I need to check in as soon as possible. My gate will be closing. Oh, they'll let us know when your gate is closing. Go back in the line. So I waited in line. By the time I got to the front of the line, that was like 20 minutes later. There is a security guard at the making sure everybody stays in line with their luggage. Then there's the lady who's letting each person one by one. 6 meters from her, there is a fumigator, the lady who's spraying your luggage. So we leave our luggage to be sprayed. Then there's a lady who's directing you to go through the other contraption of the human fumigation, where you go in and you get sprayed as well. So we go in, then we collect our luggage, and then as we get to the door, there's a lady who's asking, "Do you have your COVID certificate?" And thank God I tested negative. I had my COVID certificate in my hand with my passport ready to go and check in. No, you have to go now to the lady who's actually looking at the COVID certificates. And I found out later anyway, there was another checkpoint after, if we had managed to check in, where they're actually checking in the database. And I heard that there's criminal investigation investigators catching people with fake certificate because fake, fake certificates, because people are not realizing that uh, anytime you get a test in a certified lab, they are putting it in the database, and the airport has that database to verify that your certificate is legit. Anyway, by the time I finished all that, and I was now running to the checkout counter, I'm inside now. That was 25 minutes of that little process. Get to the, or as I was getting into the, to getting into the other area where the checkout counters are, check-in counters are, we had a blackout, electrical blackout. And I'm asking, where is the Emirates counter? Finally found it because everything was black, pitch black, and we only had little daylight coming in. And the Emirates airport manager told me the checkout is closed. The electricity is down and we cannot check you in. You have to rebook. And no matter how much I pleaded, it was futile. Anyway, and as I was observing, it took about 15 minutes. This is an international airport. There should be a generator kicking in. It took about 15 minutes for the terminals to kick in, and by then the manifest had been sent to Dubai, and I had lost it, and that was it. But I just observed that a lot of women are being hired to do this little job, and everybody is an authority of their responsibility, from the one guy who was telling everyone to stand in line, the lady who is social distancing and calling one person at a time, the lady who's doing the fumigation, the lady who's doing the entry point, the lady who's asking that, do you have a certificate, before you even go to the lady who is actually examining the certificate. They've got all little authorities, but they were completely not informed, because when I got there, she told me the airline will tell us if their checkout is going to be closing and you need to be expedited. Nothing. I lost it, and but it was of no use. So these are some of the things that I'm observing. That the one good thing that I loved was the home COVID test, where my doctor came, made an appointment for me at 9 o'clock, came, took my COVID tests. By 9:45, we were done, did took the swab samples, and by 3 o'clock, I had my lab results delivered to my house. Concierge services. That's another thing that I've been observing, that the pandemic has created a lot of concierge services. In the States, we've got Instacart, where people are shopping for you. Here, you are being offered a shopper if you don't want to comply with certain regulations, like not wearing gloves. But kudos to uh, having your COVID test done at home, because I loved it. It was worth paying for it. And I was just reading the Emirates site in Dubai. They've actually introduced a home test. If there are two or more passengers traveling, they'll come to your house, they'll do the test, and you'll get your COVID negative tests in 4 to 8 hours. So kudos to Dr. Shoniwa and the Bio Express Labs. They are certified. I checked with Emirates when I went to rebook. So they're an acceptable testing facility in Harare. And these are some of the things that we really have to observe. There is a great need for process improvement for retail stores, a great need for monitoring performance behavior and performance management. Otherwise, we can all be doing what we need to do and we are getting contaminations,